Hey everyone, it's Josh at Prescription Fitness Physical Therapy and Sports Care. I just wanted to do a quick video today talking about when we have pain after going to physical therapy. How many times as a physical therapist have we heard a patient come back and say, I came in yesterday, you worked on me and I'm worse and I hurt more, and it was what you did with me that hurt. So I think it's really critical for us as the therapists and the patients to kind of look at this very analytically and decide, okay, was it the treatment session that caused the increase in symptoms, or was it something else? So as a general rule, when we look at things, we say, okay, if I have pain with an activity, so let's say your physical therapist performs a technique on you, or that you perform a new exercise and there's pain associated with this. Well, if there's pain while I do the activity and there's pain after I do the activity and the pain persists and it rolls into the next day, then we can say with more confidence that, well, it seems like there's a high correlation that what we did caused your pain. But a lot of times patients will assume that, okay, I did a new exercise, and so the reason why I have pain tomorrow is because I did a new exercise today. So again, we sort of back up and we go, okay, does that make sense? So if I do a new exercise and I'm absolutely 100% pain-free, there's no downside, no loss of mobility, no pain. I don't have pain later that day. I wake up the next morning, there's still no pain, but the pain comes on tomorrow afternoon. The likelihood ratio that that exercise was causing my symptoms is relatively low. There's tons of confounding variables. So I always make the patients look back and go, okay, when you have pain, when you have symptoms, what are you doing right then and there? So stop, think about, okay, maybe it's not that I just got done playing tennis and it was tennis that caused the problem, but now I'm sitting, crappy in my chair and I'm all slumped, and it's really the bad posturing or the bad mechanics that has caused my pain. So be careful in how we look at this. I think the tendency, and this is also with newer therapists, is throw the baby out with the bathwater versus really sort of dig into it and say, okay, was it related to what I did, or is it simply just a function of life? And understanding the cause and effect relationship is super important. And certainly when we treat our spine patients, there's a lot of behavioralism that goes into it. You can teach a patient good posture, and I'm not a huge posture guru. I think it's nearly impossible to teach patients good posture. But if I can teach them a cause and effect relationship, that when they're sitting in a bad position, they're doing a lot of writing, let's say Christmas cards, holiday cards, whatnot, and they're starting to develop neck pain, that if they come out of that position, all of a sudden their neck pain goes away, light bulb goes off. I see cause and effect relationship. So it's a feed forward mechanism. So when we look at pain, don't always blame your physical therapist. Sometimes there's more to it. So just a little tidbit to look at, and hopefully discuss that with your patients next time they say, you caused me pain.